Tyrese Haliburton unfortunately had to be carried off the court tonight after suffering what looks like it could be a fairly significant left leg injury. And in this video, we're going to take a closer look at what exactly might have happened. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to help teach you about the medical side of the sports world. So if anatomy and learning about sports injuries interest you, then please consider subscribing. Let's go right to our play where this occurred. And of course, we're dealing with the left thigh. So the thigh is going to be the region above the knee and the lower leg. I suspect either a significant hamstring injury or an injury to one of the muscles on the inner portion of the thigh, specifically the thigh AD adductor. So I don't think we're necessarily dealing with like a joint injury. I would suspect muscle injury, potentially pretty high grade just based on the amount of stretch. So here as Haliburton goes in, of course, his right foot slips on the court, trying to plant, but of course with his right leg slipping out, he continues to go down to the ground, and then to try and counter and kind of catch his balance, he rotates his trunk over towards that left side. And what that's going to do, when people see this, they might wonder why his left leg was injured when it looks like his right side almost goes just as far out this way into the splits. But if you look and translate that back up to his trunk, so remember in this position where his pelvis is sitting. So the hamstring muscles that are on the back side of the thigh, the adductor groin muscles on the inside of the thigh, all of those muscles originate on the pelvis. And so at this point, Haliburton's pelvis is level. As he then continues through this play and his trunk starts to lean, now his pelvis is rotating. So now his pelvis has started to rotate in this direction, which is going to keep everything in pretty significantly normal, kind of neutral alignment on this right side, but it's going to rotate the origin point, the ischial tuberosity right here on his left side, further away as his left leg is going outward. So it sort of puts this double stretch on his left side. So this is why, even though it looks like he goes down and does the splits on both sides, the fact that his trunk is tilted over that left side puts more tilt in his pelvis, tilting that ischial tuberosity, that origin of those muscles, away from where they're coming off, causing more stretch. Now, if we look at kind of how this continues through, first off, look at where Haliburton grabs right away. So initially, it looks like he's grabbing on more the medial or the inner portion here of his thigh. And that's a pretty common reaction. You grab at the first spot that hurts. And so I think that's clue number one. As he continues on the ground here, of course, we see that now he's grabbing a little bit more at maybe the backside of that upper thigh, again, where those hamstrings, those adductor muscles are going to be located, and then of course needed to be helped off the court. If we look at this other view, we can see again where there's additional stretch on those hamstrings. So the hamstrings are going to originate on the ischial tuberosity up here at the buttock, go down the back side of the thigh, and when the hamstrings fire, not only do they flex the knee, so bend this part of the leg back, but they also help to extend the thigh. So they're going to pull your leg backwards. In this position, Haliburton's thigh is flexed, his hip is flexed up. That puts additional tension and stress on the hamstring muscles up at the origin. And then as he continues through, his trunk goes even more forward flexed. So not only is he forward flexed at the trunk, putting more tension on the ischial tuberosity, but from our other view, we saw how his trunk was leaned over that side, which further rotates that ischial tuberosity even more away from everything. So this is, again, kind of that double stretch position where we're going to see a lot of pulling and tension on those muscles. So now if we look at our biodigital anatomy tool here, what I've shown is the posterior muscles and medial muscle groups of the left thigh. So just orientation, we're looking at the backside here on the side. This is going to be the tailbone. So if we rotate around, this is the femur. This is going to be the pelvis. And so the ischial tuberosity I was talking about rotating is this bony landmark right up here. So it's going to be the origin of specifically the hamstring muscles and tendons right here. And then also if we rotate around to more the medial compartment, the inner compartment of the thigh, there's going to be part of our adductor or groin muscles that come off of that ischial tuberosity, specifically a muscle called the adductor magnus. Now the rest of the adductor medial thigh muscles come off of more the pubic bone here in the front. That's going to be muscles like the pectineus, the adductor longus, the adductor brevis, and then you also have some other muscles coming down through here like the sartorius, the gracilis, but these are the main big ones. So if you think about this whole anatomic position here, if you imagine taking the leg and you hold everything steady up here at the pelvis and you stretch the leg out that way, that's going to put tension on this group of muscles. So that's where number one, we could worry about a strain or pull of those medial adductor muscles. If we rotate everything around, now we're looking at the side and the hamstrings here in the back. Whenever the trunk is tilted forward, that's going to pull that ischial tuberosity back. It's going to put extra stress on those hamstrings. And then if you go into the splits with even more components of that hip flexion forward, even more tension on these muscles. So this is a perfect setup for a significant muscle injury to either the adductors or the hamstring. Quick little learning point, when we talk about hamstring injuries, if it's a sprinting, running, you're going down the field, somebody pulls up because of a muscle injury, that's more often to a muscle of the hamstrings called the biceps femoris. Whenever we see these muscle stretch injuries, that's more often like the semimembranosus. And so a little bit of minutia there, but maybe a little bit more clue that we're probably, if it's the hamstrings, dealing with more the semimembranosus. That also sits more on this medial inner side where Haliburton was grabbing, compared to the biceps femoris, more the running type strains. So now let's go back to the replay and tie all this together one more time. So of course, imagine those muscles, the medial groin muscles here on the inside, the hamstrings on the back. As Haliburton slips through here, number one, he drops into that trunk tilting over. That's going to rotate his ischial tuberosity, put more stretch on these medial muscles. And then as the leg is forward flexed, the trunk is flexed over. That puts even more stretch on the hamstrings, leading to a muscle injury. Now, when we talk about overall recovery time, it depends entirely on the extent of the tear, and more importantly, if the tear is at the tendon or if it's just within the muscle. Hopefully, this is just a tear within the muscle, because a tear up at the tendon, if significant enough, can be a surgery. Now, even a muscle injury that's a grade 3, a significant tear with a lot of bleeding, a big hematoma, can still be a multi-week, month-plus absence. But if this is a major tendon injury, we could even be looking at a surgery. And there's no real way to know just from the video replay if this is going to be tendon origin, something like a surgery possibly, or just a significant muscle strain. But I would anticipate that we're going to see Haliburton miss time. Best case scenario, a week or two, but this is probably going to be more of like a multi-week, month-plus absence, just based on the severity of how much pain he looked to be in and how much muscle stretch he saw. But we'll see. Hard to prognosticate exact timelines. I just want to give you a sense of what anatomy, what muscles we're looking at. Most likely, I think, again, medial thigh, adductor muscles, or the hamstrings. That's it for the video, everybody. Let me know, as always, any questions or comments down below. And until next time, we'll see you later.